And finally, in the area of headache and migraine, Dr. Sally Rosengren from Royal Prince Alfred Hospital. Sally.
Thank you. Dr. Welgenpoller and I would like to thank the Brain Foundation and its donors for this very generous research gift. Our research is about vestibular migraine. This is a type of migraine that's characterised by disabling attacks of vertigo, dizziness and nausea. The vestibular system is our balance system, and it's located inside the ears. When we move our heads about, our balance organs detect this movement and it sends information about that movement up to the brain. And when these brain areas become affected by migraine, it causes terrible sensations of movement and nausea. Vestibular migraine is quite common and it is treatable, but the problem is diagnosing it. It's quite variable. There are three variable factors. One is that the episodes don't always have a headache associated with them, which is something that patients and other doctors find very hard to understand, but is a little bit like having an aura without a headache. The second is that the character of the vertigo attacks can be very varied, from true sensations of spinning to a mild sensation of rocking to illusions of visual scene moving. And the one that we're interested in is the duration of attacks. Sometimes they can be as short as seconds to minutes, they can be hours long, or they can be up to days. The problem with that is that other vestibular diseases also have differing durations, and that means that vestibular migraine is a great mimic of these other common disorders. So it's important to be able to tell them apart so that you can deliver the appropriate treatment. There have been some very exciting new developments in vestibular function testing in the last few years, and we're now able to test all 5 balance organs in both ears. And we plan to apply this new technology to these patients to try and see if we can see if there are any differences in patients that have short attacks versus medium duration attacks versus long attacks. So we hope that this will shed some light on the diagnosis of vestibular migraine so that we can facilitate early treatment.